Hello everyone, my name is Isha Kinsella and I'm the Director of Midwifery for Maternity Services at Portlaoise Hospital. I'd like to congratulate you on your pregnancy and I'm delighted you have chosen to have your baby with us at Portlaoise. Our aim is to ensure that you and your baby receive the best care possible and that we can meet the individual needs of you and your baby. There is a dedicated team of midwives and other healthcare professionals who will advise you and support you throughout your pregnancy, labour and birth and in the postnatal period. Also, they will involve you in all decision making around your care. We offer a choice of maternity care, both midwifery-led care and obstetric-led care, and you can choose the type of care you would like based on your own wishes and after discussions with your maternity team on your first visit to the hospital. This year we are delighted to be able to offer midwifery-led care in the community and antenatal education classes to prepare you for parenthood, and we look forward to welcoming you here in the hospital.
Hi, my name is Susan and I am one of the midwives here at the Midland Regional Hospital, Portlaoise. Today I want to talk to you about midwifery-led care and our midwifery-led antenatal clinic here in the hospital. Midwifery-led care is when a midwife is your lead healthcare professional who will look after you and your baby throughout pregnancy, labour and birth. Once you are referred to the hospital by your GP, you will meet a consultant obstetrician who will discuss the option of midwifery-led care with you and see if you fit the criteria. The criteria is you must be between 18 and 39 years of age at booking, you must have an uncomplicated pregnancy to date, you have no significant medical or surgical history, and your BMI is less than 30 at booking. If you meet this criteria and choose this option, the consultant will refer you to our service. The benefits offered by midwifery-led care are that you will be seen by the same midwife throughout your pregnancy, which research has shown improves pregnancy outcomes, breastfeeding rates and overall satisfaction in the service. We have a designated labour room for women attending our midwifery-led service, which offers a more relaxed and homely environment for labour and birth. You will still receive combined care with your GP and routine antenatal scans. If you would like to know more about this service or have any questions, please talk to one of the midwives.
Hello, my name's Melanie Adams and I'm the Designated Midwifery Officer for the Home Birth Service here at Midland Regional Hospital, Portlaoise. Have you ever considered having a home birth? The reasons that some women might consider a home birth include that they want an alternative to a hospital birth, they want to feel more in control, and they want to avoid intervention. The home birth service is under the governance of the acute hospital services with a shared approach to care in order to ensure best outcomes for both mothers and babies. The HSE home birth scheme is a free service. This is an option available for some women with normal risk uncomplicated pregnancies. Your antenatal care will be shared between your home birth midwife in the community, the antenatal clinic in the hospital, and in some circumstances also your GP. The midwives providing the HSE home birth service are self-employed community midwives who are providing a home birth service on behalf of the HSE. Your midwife will care for you at home where you will birth your baby, and then following the birth she will visit you at home for further care and support for up to 14 days. The option of water birth is also available. If you are interested in a home birth, please discuss this with your midwife during your visit to the clinic so you can be seen by a consultant obstetrician to assess if home birth is a safe option for you and your baby. Home birth has the added benefit of one-to-one continuity of care and support from your midwife during your pregnancy, labour and after your baby is born. In the event that any complications arise during your pregnancy, labour or following the birth, your care will be transferred back to the care of the hospital-based team. The details of all the HSE contracted midwives in your area are available on the HSE Home Birth website, who you can contact directly to discuss the care they provide and the application process. You will also find my details there if you would like more information.
My name is Dr. Miriam Doyle. I am the obstetric clinical lead at the Midland Regional Hospital at Portlaoise. Together with my 4 colleagues, Mr. Hossam El-Kanini, Dr. Neve Marr, Dr. Annabella Serenitu and Dr. Shobha Singh, we provide the consultant obstetric service at MRHP. You will be allocated to the care of one of the consultants. Each consultant provides a weekly antenatal clinic. 4 are general clinics and 1 is a specialised clinic. This clinic is the combined obstetric endocrine clinic, otherwise known as the GDM clinic. Women with a history of pregnancy diabetes usually attend the clinic from their first visit. The care of women who develop diabetes during their pregnancy will be transferred to the GDM clinic. Our endocrinology colleagues, together with assistance of the clinical midwife specialist and dietitian, manage the diabetic aspect of the clinic. A new midwifery-led clinic is being developed to provide care for low-risk women. This is a welcome addition to the current care options available. All women will have a formal scan at their booking visit. All women are offered an anomaly scan at approximately 20 weeks gestation. The obstetric consultants provide cover on a 1 in 5 basis for women admitted to the hospital. This means there is always a consultant on duty. However, the consultant on duty when you're admitted may be a different doctor from the consultant at your clinic. We work closely with other medical consultants, particularly the anaesthetic service, who provide the epidural service for pain relief in labour and anaesthesia for women who require a caesarean section or other procedure in theatre. We also work closely with other medical colleagues in radiology, medicine and surgery. Our paediatric and neonatal colleagues provide care as required for your newborn babies. While most babies will not require immediate review after birth, every baby will have a paediatric review prior to discharge from hospital. Resources such as mychild.ie and whatsupmum.ie are helpful in addition to the advice available from the team when you attend the clinic. We encourage all pregnant women to avail of the COVID vaccination, flu vaccination and pertussis vaccination.
my name is Caoimhe Kenny. I am the maternal health dietitian at Midland Regional Hospital, Portlaoise, and I want to share some information about healthy eating in pregnancy. Good nutrition is important for growth and development of the baby and can influence your child's lifelong health. The following slides highlight important factors to consider for nutrition during pregnancy. In addition to these slides, I would recommend booking into our pregnancy classes.
Hello, I'm Claire Fitzpatrick, a clinical midwife specialist in lactation at Midland Regional Hospital, Portlaoise. Breastfeeding is incredibly important to you and your baby's health. It protects you from bleeding, cancers, heart disease and diabetes, and it reduces your risk of postnatal depression. Breast milk is the perfect food for your baby, tailor-made to meet their growing needs. The evidence shows that breast milk will boost your baby's immunity, providing the perfect balance of nutrients. It really is liquid gold, totally unique to your own baby, adapting and changing all the time to meet your baby's needs. The most important preparation you need to do for breastfeeding is to attend an antenatal breastfeeding workshop if you can, so that you can know what is normal and what to expect. If you know what's normal, you can get help when it's not. So do book in with your midwife for one of my antenatal breastfeeding workshops.
Hi, I'm Siobhan Flynn, CMM2 in Parentcraft here in the Midlands Regional Hospital, Portlaoise. Thank you for choosing us to look after you and your baby. You'll meet me at our antenatal classes, which we hold in Truanua Community Centre. Through evidence-based education, I hope to guide your journey through pregnancy, birth and the postnatal period. We offer 3 classes that include pregnancy wellbeing, labour and birth, and assisted delivery and parentcraft. I would also like to offer one-to-one classes for any woman who feels the need for individual learning. My goal is to give you confidence in yourself and your body so you come to the hospital energised and prepared for your birthing experience. After the birth, your midwife on the ward will demonstrate how to care for your baby. Bathing, safe sleep, newborn skincare and feeding are some topics that will be discussed before discharge. Myself and the midwives on the ward will be reminding new mums that they need care too, so we will talk to you about your postnatal well-being, pelvic floor, what to expect in the first few weeks, physically and mentally. I would like to work in partnership with you and your support person for a positive, holistic experience in your path to parenthood. Thank you.
Hi, my name is Rafina. I am the clinical midwife specialist in diabetes in Midland Regional Hospital, Portlaoise, and my role as midwife specialist is to provide care for women with gestational diabetes. The gestational diabetes team is made up of myself, a dietitian, a consultant obstetrician and a consultant endocrinologist. All women who are booked for antenatal care here in Midland Regional Hospital, Portlaoise are screened for the risk of developing gestational diabetes and offered a glucose tolerance test if they fit the criteria at 24 to 28 weeks depending on their risk. If they have a history of gestational diabetes, they are offered a test at 20 weeks and if negative, again at 28 weeks. Outside of those routine dates, other women are regularly identified at antenatal clinic as requiring urgent glucose tolerance test. Approximately 15% or so of those tested are positive for gestational diabetes. Once positive, the woman is invited by me to a joint education session with myself and the dietitian. These education sessions occur weekly and provide a comprehensive and holistic view of gestational diabetes and their requirements for monitoring blood sugars. These women are deemed high risk and their care is transferred to the gestational diabetes clinic for regular review by the obstetrician. They are also reviewed on a regular basis by the consultant endocrinologist. After the delivery of the baby, the woman is offered a repeat glucose tolerance test 6 to 8 weeks postnatally to ensure blood sugars have returned to pre-pregnancy levels. They are also advised of the risk for gestational diabetes in subsequent pregnancies and of developing type 2 diabetes later in life. The staff in Midland Regional Hospital, Portlaoise are here to advise and support you during your pregnancy. We look forward to meeting you.
My name is Yolanda and I'm the clinical nurse manager here in the Special Care Baby Unit. We care for all infants who are born here in Portlaoise who require special care which cannot be provided on the maternity floor. We have many highly skilled paediatric and neonatal nurses, and we also have our paediatricians and specialised infant doctors. Your baby may have to be admitted for jaundice, or they may be having feeding issues, or they might be born prematurely. If your baby is born very prematurely in another hospital, your baby can be transferred back to us once he or she is stable. Depending on the reason your baby is admitted, your baby will be nursed in a cot or an incubator. We will monitor, observe, and provide any treatment required for your baby. You or your partner can visit your baby at any time. Once your baby is well enough, we can discharge your baby back to you on the maternity floor. Sometimes, babies admitted have to stay longer than your hospital stay, but this is something we can discuss if the situation arises. We would ask that you provide some baby grows, vests, and nappies while your baby is here with us. We can also teach you about bathing and caring for your baby's umbilical cord, and help you with feeding or expressing breast milk. Some of the equipment that we use can be very different to what you have seen or experienced before, so it is really important that you ask us any questions you may have.
My name is Audrey Smith and I'm a clinical specialist physiotherapist in women's health here in the Midlands Regional Hospital, Portlaoise. Physiotherapy plays an important role in the antenatal period. We deliver early antenatal education classes educating women on the importance of exercise to stay fit and strong during your pregnancy. The WHO recommends pregnant women aim for 30 minutes of exercises 5 days a week, or 150 minutes in total per week. Exercise supports your body for carrying your baby and reduces the risk of low back pain while preparing your body for labour. We also give advice and exercise to help manage pregnancy-related pelvic girdle pain and other muscular issues that can occur during pregnancy. Bladder and bowel education is also issued together with the teaching of pelvic floor exercises. The pelvic floor muscles are a group of muscles at the base of the pelvis that supports our bladder, bowel and uterus. We activate these muscles by squeezing our back passage as if we're preventing ourselves from passing wind, and also as if we're preventing ourselves from passing urine. You should feel a tension or lift-like feeling in this area. You should try holding this tension for a few seconds. It is important you feel the tension or lift-like feeling let go, as this is the muscles relaxing. Pelvic floor muscle training is important to do throughout your pregnancy until about 36 weeks, unless your pelvic floor physiotherapist or medical doctor has advised you not to do them.
We encourage all women to keep active during pregnancy. Regular exercise helps to ease pregnancy discomforts such as back and hip pain, restless legs and insomnia. It also helps to get the baby in the best position possible for birth. If you are active before becoming pregnant, keep up your normal exercise routine for as long as you are comfortable. Slow down as your pregnancy progresses. If you have never exercised before, start slowly and increase gradually. For example, start with 15 minutes of exercise 3 times a week and build up from there. You're aiming to build up to 150 minutes of moderate intensity exercise a week. Walking is a fantastic exercise and a great place to start. Pregnancy yoga, swimming and aqua aerobics are other examples of exercises that can feel great during pregnancy. Also remember to sit with your hips higher than your knees whenever possible. If you're sitting for long periods, set yourself an alarm to stand, stretch, do some sideways lunges or pelvic tilts. Try a standing desk or a yoga ball to help keep your pelvis mobile and baby in an optimal position for birth. While you're physically preparing yourself for birth, please remember to mentally prepare yourself too. Think about what a positive birth experience is for you. Practice your deep breathing, attend your pregnancy classes, and read the HSC My Pregnancy book to help you mentally prepare for a beautiful birth.
Hi, my name is Aisling. I'm one of the midwives that works in the outpatients department in Portlaoise Hospital. After your pregnancy has been confirmed by your GP, they will send in a referral to our central bookings office. The referrals are then triaged by the consultant and classified by high risk to low risk. Since COVID, we have been conducting over the phone bookings. Here, a midwife will call you at a pre-arranged and agreed convenient time. During this phone booking, the midwife will take an obstetric, a medical, social and a family history. They will also be able to discuss antenatal education such as healthy eating and vaccines. A follow-up appointment is then made for your first antenatal clinic appointment. During this visit, your dating scan will be performed. Partners can attend this scan. You will then meet your midwife, see your assigned consultant, and with your permission, have your bloods taken. This is also a good opportunity to bring up any questions or queries that you may have. Your consultant will advise you of your antenatal appointments, which is your schedule which is shared with your GP. Your anatomy scan is organised for between 20 to 22 weeks of pregnancy. You will be notified of this appointment by post at around 19 weeks of pregnancy. We look forward to meeting you at our clinic.
My name is Yvonne and I'm Clinical Midwife Specialist in Ultrasound. Myself and my colleague Aideen performed a majority of the booking and anatomy scans in Portlaoise Hospital. The booking scan is done at your first appointment in the hospital. This helps us to determine when your baby is due. This is often the first scan people have and they get to see their baby's heartbeat for the first time. The anatomy scan is done between 20 and 22 weeks. This is a top-to-toe check on your baby. We look in detail at the structures in your baby such as the brain and heart and also check to make sure your baby is growing normally. Sometimes we might see something on scan which might need a second opinion. If this happens, we talk to your consultant and sometimes organise a referral to the Coombe Hospital for a second opinion with a fetal medicine consultant. The fetal medicine consultant is an expert in ultrasound and will advise you if your baby needs any further screening or tests. If you want to know the baby's gender, you can find out at this appointment so long as the baby is cooperating. If your baby is in a good position, we will take pictures for you and your partner to bring home and share with your family.
Hello, my name is Emma Mullins and I'm Clinical Midwife Manager in the Maternity Department here in the Midlands Regional Hospital, Portlaoise, and I would like to welcome you here to our unit. The midwifery unit is situated on the second floor, and along with our delivery rooms we have a lactation room and the Willow Suite, which is a bereavement suite designed specifically for women and their partners who have had a pregnancy loss. Midwifery care in the maternity department aims to deliver safe, high-quality, woman-centred care. Giving birth is one of the most significant, rewarding and positive life experiences. Childbirth is viewed as a normal physiological process. Midwifery care is provided in partnership with the woman and her partner and in collaboration with other healthcare professionals. On the corridor before the delivery suite, we recommend the hopscotch station. This is a useful tool to help and support you on your birthing journey. The delivery suite offers a home-from-home environment whereby women can avail of various birthing options, such as the multi-track chair and sling, the birthing stool, the birthing ball and the peanut ball.
Hello, my name is Jackie and I'm a Clinical Midwife Manager in the Maternity Department. I work alongside and support my midwifery colleagues caring for women and babies in the antenatal and postnatal period and during labour. My role also involves reassuring mums and their partners and helping to address any of their concerns. Myself and my midwifery colleagues aim to deliver midwifery care that is holistic, personalised, women-centred and respectful in nature.
Hello, my name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created Labour Hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of Labour Hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The Labour Hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the Labour Hopscotch is called the mobilised square and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced Labour Hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.
tour of the labour ward. Please call the Maternity Assessment Unit or MAU prior to arrival at the hospital on 057 86 96 370. Have your name, date of birth or hospital number ready and let us know why you are calling. For example, you may feel a reduction in your baby's movements, or think labour is starting, or your waters have broken. We will be able to advise you and suggest coming to the hospital or staying at home, depending on your situation. If you are advised to come into the hospital, please park in the main hospital car park and make your way to the front entrance. The staff at reception will ask you how they can help and direct you to the Maternity Assessment Unit. At the elevator or stairs, go to the second floor. When you get to the second floor, the MAU is on your right-hand side. Here the staff will take your details and ask you to wait in the waiting area until a midwife is available. The midwife will bring you to an assessment room and check on you and your baby. If you think you're in labour, the midwife will discuss your birth preferences, feel the position of the baby, check your baby's heart rate using a fetal heart rate monitor or CTG for about 20 minutes while assessing your contractions and checking your vital signs. They will ask to perform a vaginal examination with your consent if it is required. If you're not in active labour, you may be able to go home. If you're in early labour, you may be admitted to the antenatal ward. Here you will be given a birth ball and advised to use the labour hopscotch to help labour progress. If you are in active labour, when the cervix is dilating, you can go to the labour ward and meet your midwife. You will stay on the labour ward until your baby is born. In the labour ward, we have a home from home room. The home from home room is recommended for women who would like to stay active in labour. Here you can use the multi-track system, the shower, the birth stool, along with any comfort items you may have brought from home, like your own music, pillow or scents. Here is an example of another labour ward room, which can be made as homely for you as possible. The bed can be moved into various positions to aid descent of your baby if you get an epidural. We can also use the peanut ball to help open your pelvis. There are resuscitators in each of the labour ward rooms. We use this if the baby requires extra help breathing when they are born. The CTG machine is also in all labour ward rooms and is offered to women who require continuous monitoring while in labour. We also have storage for any equipment we may need. Entonox, or gas and air, which is piped into each labour room, can be utilised while using the birth equipment. After the birth of your baby, you will stay in the labour ward for around 2 hours, and then you'll be moved to the postnatal ward until the day of your discharge.
Hi, my name is Carly and this is my colleague Georgina. We are midwives in the Midlands Regional Hospital of Portlaoise. This is one of our delivery suite rooms. When you are in labour, a midwife will provide support and care and be with you throughout your birthing experience. The midwife will discuss with you your birth preferences, pain relief options, and will monitor your baby's heart rate when you are in labour. This can be with a Pinard, a sonic aid, or a CTG monitor. After the birth, your baby will be placed skin to skin onto your chest.
Hi, my name is Deborah and I'm a healthcare attendant here in Midlands Regional Hospital, Portlaoise. Healthcare attendants work with the midwives to care and support you during your time here in the hospital.
My name is Niamh Maher. I'm a consultant obstetrician and gynaecologist in Portlaoise Hospital, and I'm going to speak to you just a little bit about induction of labour and what actually happens when you're told that you need to come in for induction. So typically we induce women routinely for being post-dates. So post-dates just means that you're approximately 7 up to sometimes 14 days past your due date. There are other reasons for induction of labour, such as some medical issues that might arise during the pregnancy, to do with the size of your baby, to do with your blood pressure primarily, and other significant medical implications. So generally what happens when you come in for induction, you're in through our maternity assessment unit, and at that point you have a tracing done of your baby's heartbeat and to make sure all looks okay. After that, then you're admitted to the ward. On the ward you generally will see one of the medical doctors and also one of the midwives that is on duty. At this point you will have an examination just to see how favourable that you are for induction of labour, and by saying that you're favourable, it's to do with to see if your cervix is dilated in any way, or if you need some assistance with a hormone gel, prostaglandin gel, in order to allow the cervix to dilate and allow your waters to be broken. So it really just depends sometimes on how many children you've had already as to what way your induction starts. But generally the types of induction that do occur are to do with having a gel or a prostaglandin gel, making your cervix more dilated so that we can break your waters. And then after the waters are broken, some women will go into labour by themselves, but others will need some assistance with a drip called oxytocin, which is basically something that your body produces anyway by itself, but this accelerates it or augments the type and gets you into labour. So once you are in labour, your labour proceeds as it would as if you'd gotten into labour completely by yourself. And at this point in time, you would be on the labour ward. Your baby would be monitored with the CTG and the heart rate monitor. And also at this point, we'd be watching the CTG to see that the baby was happy with how the labour was proceeding. And again, as I said before, the type of labour that you have once labour is established is exactly the same as if you'd actually gone into labour by yourself.
Hi, my name is Abby. I'm a midwife in Cavan General Hospital. I want to show you different movements and positions to support you in early labour. If your waters are broken or you have been advised by a healthcare professional to come into hospital when labour starts, these movements and positions can be utilised in the hospital setting. We advise that you remain at home as long as you are comfortable to do so, or until your contractions are a regular 3 to 5 minutes apart and lasting 50 to 60 seconds. Please be mindful of your distance to the hospital, and you can phone the maternity unit at any time where the midwife will advise you. Moving around and changing positions in labour can help relieve pain, shorten the length of time of your labour and distract you from your contractions. Movement in labour makes sense. Your body is usually upright, which means gravity is helping to move your baby down your birth canal. Walking in labour will help to open up your pelvis. When you are standing, rocking or swaying your hips from side to side or in circles with feet and knees apart may help to relieve pain or tension in your muscles, and it may also help to speed up labour. Music and positive affirmations will also help. If your labour has slowed down, walking up and down the stairs can help speed it up. Sidestepping or lunges will open your pelvis at varying angles as you move up or down the stairs. This encourages your baby to move down into an optimum position for birth. When using a birthing ball, you can complete many different movements, including figure of 8, hip circles, rotating back and forth, and the pelvic tilt. Gentle neck stretches and shoulder rolls will help to relieve muscle tension. As with any exercise or movements that we talk about, always rest if you are becoming tired. If you feel you need to rest, lie on your left side and place some pillows in between your legs. If you feel unwell, stop, take a break, and talk with a midwife. You could also try and rest in a warm, not too hot bath, or sit backwards on a chair or toilet. Many women find the all-fours position comfortable as it takes some of your baby's weight off your lower back and helps to relieve back pain in labour. It will also give your baby more room in your pelvis. Kneeling can be done on the ground using a yoga mat or pillow on the bed. The pelvic tilts can also be achieved in the all-fours position. This is also a good opportunity for your partner to provide some physical support by gently rubbing your back or shoulders. Use your birthing partner to lean on for support in a standing or squatting position. They can emotionally support you in this way too. Supportive words and affirmations during your labour will stimulate the love hormone oxytocin. This will encourage your contractions and release endorphins, unnatural painkillers. The really important message for you is to keep moving and changing positions during labour, whether at home or in the hospital. Your birthing partner or midwife will be there to guide, support and offer suggestions to you.
We recommend you coming into hospital in labour if your waters break or when your contractions are coming regularly. For first-time mums, once contractions are happening once every 3 to 4 minutes and lasting 60 seconds, bearing in mind your distance from the hospital. For mums who have had a baby before, once contractions are in any way regular, for example every 6 minutes, or if they are intense, please make your way to the hospital. If at any stage you are finding your contractions unmanageable at home, if your baby's movements are decreased, if there is any fresh red bleeding, or if your waters break, please come into the hospital straight away. If you're in any doubt, please call our maternity assessment unit on 057 86 966 370. When you arrive at the hospital and park, you'll go through a porta cabin outside A&E. From there, you'll be escorted to the maternity assessment unit for assessment to see if you need to be admitted or if you can go home. A midwife will assess your contractions, ensure your baby is well, and if needed, perform a vaginal examination with consent. Once admitted, you will go to the antenatal ward or the labour ward. On the antenatal ward, you will be encouraged to be mobile and active until your contractions are strong and regular. Here you can utilise the equipment on the ward. There are baths, showers, birthing bowls, stools, bars and steps. This is the perfect opportunity to let the labour hopscotch guide you. When you're on labour ward, you can use the multi-track system. The multi-track system is a piece of equipment to aid active labour. You can use the bowl or stool, and your support person can sit on the chair behind you at the same height to give you a shoulder or lower back massage. The rope is also useful for a labouring woman to pull on and support herself whichever way she finds comfortable. You can also turn around and kneel on the mat whilst leaning onto a birth aid or into your partner's lap. It is a safe and effective way to progress your labour while assisted by your midwife.
And if it's okay with you, we're going to pop on the CTG monitor. This is our cardiotography, and it gives us a little insight as to what baby's doing at the minute. Are you comfortable like that? Yeah, very. Super. So first I'm going to give you this clicker. Every time you feel a baby moving, if you could give that a click, I'm going to feel baby's position. Lovely, so baby feels nice and head down, Leonie. That's great, you're doing loads of good work. So next I'm going to put some jelly on this bit of the monitor. Let's go in and around here. And if you can hear that, that's baby's beautiful heartbeat. Sounds perfect. So we're going to leave this on for about 15-20 minutes to get a good baseline of what baby's doing, and then we'll get you up and moving again. Baby's beautiful heart rate. This one's going to measure any pressure in the uterus, so it'll show us if you're having any contractions. And it's just nice to get to know what baby is doing with the contraction to make sure they're coping well. The last thing I'm going to do is put this on your finger, and that just tells us your pulse, so you'll get your pulse and the baby's pulse mixed up. Is that okay? That's perfect. Now let's give us a beautiful reading.
Hi, I'm Michelle, one of the midwifery managers here on the labour ward. I'm going to discuss pain relief options in labour. For early labour, when contractions are mild and irregular, the bath or shower are excellent for pain relief. You may wish to try going for a gentle walk or try to distract yourself by watching a funny movie. If you can rest or nap, then please do. Once contractions don't allow you to nap or to lie down, you should stay active and as upright as possible to aid descent of the baby into the pelvis. TENS machines are another option for pain relief, which can be used at any time from early labour onwards. The TENS machine uses mild electric currents to help reduce pain signals to your brain. Once you're in the hospital, pethidine, Entonox and epidural will be available to you. Pethidine is an injected medication that can reduce pain and make you sleepy. This could mean you may be able to have a nap in between contractions. This medication cannot be given if your midwife feels the delivery of your baby is imminent, as it can make your baby drowsy and less likely to feed. Entonox is an inhaled gas. It's a mixture of oxygen and nitrous oxide gas. Gas and air will not remove all of the pain, but it can help reduce it and make it more bearable. It's easy to use. You control it yourself. You breathe in the gas through a mask or a mouthpiece, which you can hold yourself. It has no adverse effects on the baby. The epidural is a type of local anaesthetic medication. It's injected into the spine by an anaesthetist. It's usually really effective at completely removing any pain, though 1 in 10 women will require alternative analgesia. It may cause your blood pressure to drop and possibly your baby's heart rate to drop. You will need to be monitored very closely and will need continuous fetal monitoring and IV fluids. Please speak to your midwife or your doctor at your next visit about any pain relief options you're considering for a more in-depth review. Know that whatever you choose, you will be supported by your midwife for the best possible birth experience.
My name is Emma and I'm a midwife in the Midland Regional Hospital, Portlaoise. If you're having a planned section, your consultant will give you a date to come to the hospital. There are occasions where an emergency section may be required. When you arrive in the theatre, you will see a team of doctors and nurses, and a midwife will be with you at all times. You will be asked to sit on the operating table, and the anaesthetic doctor will place your spinal anaesthetic in your back so you won't feel any pain. It is normal to feel some rooting, tugging or pressure at certain parts of the surgery, but you will not feel any pain. Once you're comfortable and your anaesthetic is working, the surgical sterile drapes will be placed over you and one of the nurses will bring your support person into the room to sit beside your head. The baby is usually out within 10 to 20 minutes after the operation begins. Your midwife will then do a quick check head to toe and weigh your baby and give them the vitamin K injection with your consent. Then your baby will be placed on you or your partner for skin to skin. Once you're stable, you can feed your baby and continue skin to skin until you're back on the maternity ward.